So David's come in, he's got a little strain to his back, he's been rock climbing. He feels some pain over this left flank here. So we're just going to have a little feel down, just palpate as we go, see if we can feel anything that doesn't quite feel right to our fingers, but also obviously get David's feedback as we're going here. So I can just feel like I'm getting onto something here. How does that feel there, Dave?
Yeah, quite tender.
Are we on the spot there, would you say?
Yeah.
Okay, so that by my reckoning is the edge of the quadratus lumborum muscle. It's just coming onto the 12th rib, we can feel there. And it's coming down towards the iliac crest, which is here, quite deep in, and the little strand, little tight band of muscle there. Probably just the average sort of strain, he's overdone it a little bit. So we'll just work into that first of all. Just going to give that some real pressure with the fingers. Just sustained release, just working now across the fibres. So the fibres are going up and down like this, and I'm pulling across a 90-degree direction to the fibres, so it's cross fibre, soft tissue. It's a really good way of stretching out the individual fibres and also stretching out the little stretch receptors which occur within these muscles, the muscle spindles. And you'll notice that I'm doing this, I'm being very firm, but I'm also being quite slow. And there's a reason for that. If I was to do it very fast and really do like a sort of deepish but quite fast flicking sort of massage, that would end up irritating the little nerve endings within that muscle. And the likelihood would be that would spasm rather than release as we're trying to get it to do. Okay, we're still on the spot there?
Yeah.
Today?
Yeah.
Okay. And again, often we'll ask my patients then what sort of pressure that feels like. So out of 10, 1 to 10, David, what would you give that?
That's 7.
About 7, that's right on where we want to be. So 7 out of 10 is really the ideal amount of pressure, and that's dependent on the patient rather than what I think is a 7 out of 10. And again, there's some reasons behind that. If I was to be doing it too strong, the chances are he would just tense against me. And if it wasn't deep enough and strong enough, it wouldn't really release. Okay, so we're just starting to feel that ease off a little bit now, which is good. If I wanted to work a little bit deeper than that, and this is something some of our massage therapists use and osteopaths and physios, it's just a massage tool basically. We call this instrument assisted soft tissue release. So rather than my thumb coming in or my finger, I'm just going to be using this little device here, and that helps just to sort of get into that area a little bit stronger, slightly different way. I can just work on that muscle in a little bit of a different way. Maybe introduce a little bit of friction if I wanted to, if I felt that was a bit fibrous in there. Again, how are we doing there, David?
Yeah, good.
So that feels stronger than my fingers or similar sort of pressure at the moment?
Yeah, quite similar.
Okay, that's good. Okay, might give that a little bit of a stretch, just to get it to ease up. Okay, just relax there, Dave. I'm just going to pop a little needle on that now. Just a single needle, probably just an acupuncture needle, but we'll call, this is part of the dry needling that we do. And really, if you think about it, it's not that dissimilar to an injection, except I'm not actually injecting anything. I'm just sticking the needle into the muscle. There's been quite a few studies now that have been done to show that dry needling, i.e. injecting something without actually using the syringe or putting anything through, has the same effect as often squirting some steroid and even other substances into it. But obviously this is a lot less toxic. It's just a sterilised needle. I'm just making sure by doing it this way that I'm missing any internal organs. Coming down this way rather than going in. If I went in that way, there's a risk I could hit his kidneys. So I'm palpating through, making sure I've got onto the muscle fibre. And we're just going to come into that, and in a second hopefully we'll hit that little knot. There we go. You see that little twitch? There we go. See it now twitching? That means there we go again. Lovely. That means I've hit that trigger point, and that's going to be stimulating the blood vessels in the area to dilate, which will hopefully bring a bit more oxygen to that particular part of the muscle. which should then help the healing process and help that muscle to release. Can you feel that, Dave?
Yeah.
Okay, he can feel that. Okay, and we'll just leave that then for a few minutes. What I'll do in a few minutes' time, I'll come back, I'll test that needle with some probing, and we should hopefully find that it's not reacting, not twitching and quivering quite so much as it was just now, and that then will show us that muscle then has released off nicely. So it's not a case of littering the patient with needles, as might happen with traditional Chinese acupuncture. We're being very, very specific to the point. In this case, I'm only going to be using one needle. Sometimes I might use 2 or 3 in the area, but it's very, very focused, very, very specific. It's not to the point, but also the depth as well. Very important I get the right depth and the right length of needle. Now in this case, this is a perfect size needle. If, for example, I was going into something like the buttock area, again, depending on the size of the patient and the thickness of the muscle, I may need to use quite a long needle. You've got to appreciate that muscles are 3-dimensional structures. So it's all very well saying the patient saying, well, okay, I've got a problem here. We locate a trigger point in the muscle here, let's say glute medius or something. But how deep in that is that? So it might be the right muscle, but is it that far in? Is it that far in, or is it that far in? And again, I'd need to use that appropriate length of needle to get to that particular knot there in that spot. And really, I'd be going in, and I wouldn't be happy until I got that little twitch response that we hope you just saw in the muscle earlier on. Okay, so we'll give that a little test again. So I'm just going to make sure the needle's facing the right way. Okay, it's still quite reactive in there. Let's have a little look there. Okay, Dave, how's that feeling?
Yeah, still very.
Still twitching away.
Still feel that, yeah.
Okay, so he's not quite done yet. Okay, so you can feel that as I'm moving that, David, which is I'm not surprised about. But once I've left it there, how's that feel now I've left it?
Yeah, you can't even feel it.
Can't feel it, exactly. So, a lot of people get worried, think, sticking a needle right in the muscle, is it going to be sore? Well, it is a little bit sore when we get that little twitch. It's only momentary. And then once we leave it, it's just, you can't really feel it, and it's perfectly comfortable. Okay, so one of the other techniques we sometimes use with the dry needling is we use what's called a fanning technique. So if you imagine that there's a knot in this muscle in here, but it's not really a single knot as such. It's actually a collection of little individual muscle fibres that are in spasm, that are tightened up, and what we call sarcomeres, which are individual contractile units within even a single muscle fibre. So really, what it's a case of, to get maximum release in that muscle, we might not do this on the first occasion, but on perhaps subsequent occasions, let's demonstrate here. We just re-angle the direction. So we're going to come out slightly, and we're going to re-angle a little bit of a different position, and then sort of going to the same spot, but just reorientating it. Imagine I'm just sort of going around a clock face. And sometimes what happens is just moving a couple of millimetres like this I'm doing now will make the difference between getting extra little twitch responses and therefore extra release in the muscle that we're aiming for. Can cause a little bit of extra tenderness after, which is why we would often reserve this for perhaps a second, third or even fourth session. Okay. And again, how was it that time, Dave?
Yeah, it's a little bit less now.
Not quite such a strong twitch this time.
Not strong.
Good, so that's the sign we want. It's starting to release off. Excellent. Okay, just going to double check again. I'm not going to leave it too much longer now because it's had quite a while. So, yeah.
Yeah, it's almost.
Less than it was. Almost gone.
Yeah, almost gone.
Good. So we'll come out of that. And again, you can see there's no blood there. No nasty things going on. These needles that we're using are very, very thin. The tip, they're 0.25 of a millimetre thick in that case. Sometimes we go up to 0.3, but you can see there's no blood or anything like that. And occasionally you get a little speck of blood, but 1 in 10 needles, just a little bit of tissue in it, dries it all up, so not a problem. And once we've done that, again, it's often good just to get into that area again, just give it some more stretch. And you often find after having done those needles, then you can usually feel the difference yourself, and also the patient can usually feel the change as well. So I'm just going to give that some pressure. Yeah, so it's definitely not as knotty as it was.
Yeah, I doesn't feel it.
Yeah, it's a lot more spongy in there now. It's really good. Still feel it slightly. He'll probably need another 1 or maybe 2 goes on this to get it to fully release off. But certainly in this case, in David's case, this is just a simple strain. He's overdone it with some exercise. I can't imagine more than 2, 3, or maybe 4 treatments would be enough. Would be all that's needed. Obviously, if this is something different, if this is more of a chronic sort of back problem, if this was muscle spasm due to some sort of disc problem in the spine, and this muscle was just reacting because of the disc, we'd need to be getting, more tackling the root cause of it all. So it could be a disc problem, could be a facet joint problem, could be all manner of things, which is why then sometimes we go quite in depth and get patients to have MRI scans done to see if there's any deeper pathology that we need to be thinking about and working on, or possibly even referring on to spinal surgeons or pain doctors for other procedures to be done. But I think in David's case, he's perfectly going to be okay. Nothing that we can't sort out with a bit of this sort of treatment. But what you will find is that these sort of problems, if they're left like this, can become quite chronic. The muscle can sometimes become very fibrous then, and you can get mechanical changes happening just because of one simple injury. Excellent. So my advice to David would now just be to really rest that for a couple of days. Do some light stretches within probably 48 hours, but nothing too immediate. Just let that all settle. He's possibly going to feel a little bit bruised tomorrow, just when I've gone in with the needles and the strong massage in there. But once that bruising has settled down, the post-treatment soreness is gone, he should feel a lot better. Even while that bruising is still there, that feeling is still there, he will still hopefully recognise and feel that there's some improvements there, and the area is a lot looser. So he should even really, as he gets up now, recognise that, and certainly later on today and tomorrow, should definitely feel some improvement, I would have thought.